So as I was saying, I work at Women's Imaging, and recently I did go and spend a day with Sophie in Melbourne, and she suggested that it would be good to have a different perspective of scanning, looking for endometriosis, just letting people know that anybody can do this if they are interested. So what you need, I work at Women's Imaging, as you know, and we sort of focus on a few examinations, and we like to perform those well. So we spend a lot of time looking at our examinations and being told if we need to improve, and never resting on our laurels and always looking for ways to improve. So it's a good workplace to work. We have supportive staff. We've got the obstetricians and radiologists, and just feedback from our fellow sonographers as well. So just with that background, that makes it easier to be moving forward and introducing new things into your scanning techniques. So we were already sort of doing quite detailed pelvic scans, and we decided to look a bit further and have a look for endometriosis. So I looked at the videos that are available online, and I found them very, very helpful. They're easy enough to find, just Google. And the advantage of looking at the videos online is that you can look at them, try some of the techniques that have been advised, and then actually come back and have another look at them later when you sort of want to reinforce some of the techniques. As I was saying, we had it is a good workplace. We had a training day set up where we had a room full of endometriosis patients booked. We scanned them in one room, and we had a viewing room set up next door. Sophie came for the day, and we all had a go at scanning with her, watching what we were doing and sort of explaining how we could improve all our techniques. So that's one way of sort of improving your technique. After that, I went to Melbourne for a day and worked at Sophie's place as well. And I think that was a good way to see that what I'd learned I was putting into good practice. I think at each step along the way I sort of learnt something new. Like when we had the training day, I think at the end of that I was much better at looking at the bowel, and perhaps after I'd been to Sophie's I was better at looking at the uterine sacral ligaments. So I think each step, as long as you're putting in the work, you're sort of learning something new. Other ways that you can learn is reading articles on the internet, or like taking advantage of days like today and coming to conferences. And I think the take-home messages, which I think are good for other sonographers to think about, is to just remember to look. The more that you look, the more you'll find, and remember to look for the telltale signs. So I think I'm just going to mention sort of the basic things that I think that each of us could sort of introduce into just your basic pelvic scans, just like Sophie said before. And so if you see an endometrioma, most likely you're going to find more disease. So, you know, this is an obvious one that we'd all see. And so just remember to look a little bit further afield. And like we can see here is some more deep infiltrating endometriosis that we might have missed if we didn't look a little bit further. So areas that you can look at are the uterus, and check for mobility and the position of the uterus. Then look a bit further afield, like anterior and posterior, and sort of try and correlate it with the patient's pain as well. So with the mobility, you can see just by pushing on the uterus a little bit, you can see if the uterus is going to move or not. And so again, looking at the noticing the position of the uterus. So the one on the left is like just a normal anteverted uterus, and you can see that stays or moves nicely. And then the one on the other side of the screen, is you can see that the uterus is retroflex, so that would make me more suspicious and to look a bit further for infiltration. You can also notice, like here, the pouch of Douglas really doesn't move very well, so there's some sort of disease or something happening there. It just doesn't want to move. And keep looking a little bit further. So here we've got the vaginal wall here, and so this is one side of the vaginal wall in this patient, and I can see the nice thin rims here. And then if I go to the other side, this area is thickened, and so just comparing one side to the other or getting used to looking at those areas, you can sort of just pick up changes. And so looking at the ovaries as well, so looking at how they're positioned and how they move. So position-wise, you know, not all ovaries, but most ovaries sit up nice and high and laterally, sitting near the iliac vessels. But if I was to see this picture with two ovaries like sitting down quite low posteriorly in the patch of Douglas, I'd be really suspicious that there was some disease happening, so that would make me look further as well. Again, so looking for mobility. So we've got the ovary here. Actually, I'll just get back on. So we've got one here, but then when I push on it, we can see that it moves nice and freely as well. So just looking at all, remembering to look at all the margins. And just in this case as well, so this one here is moving nicely, but then this one here, it does seem to move on some edges, but then if I actually look really closely, I can see this area of disease happening down here, and just that very medial margin of the ovary seems to be stuck and not moving. So I guess really what I'd just like to say is that everybody can take a little bit extra time if they're interested and have a look in all of these areas. There's lots of opportunities and resources available for you to sort of learn a little bit more and just pay a bit more attention, and you will find more endometriosis the more you look. And considering the patient's pain and sort of trying to work out what the pain is coming from. It's also important that by doing that, you might change the quality of a person's life by finding that endometriosis for them. And that's about all I have to say. So thank you.